So do Discseel procedures actually fail, I think is the real question. If you look at the literature, what we speak about from 18 to 20% retreatment rate, what that means is that the patient may not get the clinical outcome that they were expecting with one particular treatment, but that doesn't mean necessarily that it failed. With a Discseel procedure, it is a very specific approach to affecting disc herniations in a really unique way. And for the most part, it's about repairing them and not cutting them out. But at the end of the day, when we compare a Discseel procedure to a traditional surgical procedure, if we're comparing apples to apples, a spine fusion is a 50% frank failure immediately following, meaning that patients fail to improve or they get worse. And if it's a microdiscectomy laminotomy, it can be very successful in the short term. But if we look at it from a longer term format, then essentially the vast majority of those are going to fail in the sense that they're going to develop accelerated degenerative change because we're removing tissue and destabilizing that motion segment. With a Discseel procedure, I don't consider that necessarily a failure if we don't meet your expectations, because we still have all of our tissues in place. And essentially that particular procedure didn't solve the problem as it relates to your symptomatic presentation. So if somebody comes in with a simple disc herniation with leg pain or sciatica at one segment, then the likelihood that the Discseel procedure will fail is very low, especially if we select appropriately and the patient is metabolically healthy and they don't smoke and they don't drink excessively. If we select appropriately, because it's one segment and it's consistent with a radiculopathy, those procedures go pretty well. The likelihood for success is extremely high. Now, I think where we run into trouble is the majority of the individuals that do Discseel procedures come from a traditional orthopedic background. And what happens there is they have a myopic view of spines, let's say. They see a disc herniation, they see some symptomatology, and they say, okay, let's fix the disc. And I agree, Discseel is probably the superior approach because we're able to keep all of our tissues and we're able to do it in a minimally invasive environment without any downtime. So that's a wonderful thing. However, there are many pain-sensitive tissues in a spine, and there are many things that are typically going on with the spine, even if it has a disc herniation, that present with the symptoms that patients experience. So what I find is that if you don't take a comprehensive approach to treating the entire spine, not just the disc, using multiple biologics that would be appropriate for healing those tissues, then what happens is we may not meet the expectation for that particular patient, meaning that they may not get the result that they're actually looking for. So in that regard, or when we say failure rate, essentially, in my opinion, I think it just means that the patient didn't get to the point where they're happy with the outcome. With that being said, I think it's a wonderful thing that we do have the opportunity to retreat, right? Remember that we're not removing tissue. It doesn't create any, deleterious or long-term effects. It is not a permanent process. There's still lots of things that we can do at that stage of the game, including surgery if it's warranted or necessary. But more importantly, we have the opportunity to retreat, and I think that's an important term. With that being said, I think, just in terms of selecting patients, when we're evaluating patients, if we have enough clinical experience where we've seen enough patients, especially in a regenerative environment or in a minimally invasive environment, it's really important to understand their general health, right? So there are many factors that will contribute to chronic degenerative problems. Obviously, if somebody has an injury, that's a different story. But we really want to learn a lot about what their lifestyle looks like, because that's going to play into the likelihood for a successful outcome. So just as an example, on one end of the spectrum, an insulin-dependent diabetic with, a chronic spine disorder is not going to improve at the level that a professional athlete with a simple disc herniation is, right? So we have to understand that. And that's two, ends of the spectrum, and there's a lot in between that we have to uncover. We pay a lot of attention to patient selection, and it doesn't always mean that we turn a lot of people away. It just means that maybe we do a bunch of work up front to create an environment that's conducive to healing so that we can get the very best possible outcome long term. So, in terms of retreatment rates, and I'm not going to speak specifically about Discseel, we never do Discseel by itself, right? The Discseel procedure, it's an important part of the process for any disc pathology that exists within that particular patient. However, we always want to pay attention to the posterior compartment, the facets, the ligaments, the joint capsules, the myofascial tissue, the pelvic girdle if it's a lumbar spine. It's really important to address globally so that we can, again, achieve our goals. And our goals are not just pain relief. Our goals are long-term quality of life, giving patients the opportunity to continue to exercise and move, because that's absolutely essential as we age. The minute we become sedentary is the minute our health declines rapidly. So we have to take a holistic and comprehensive approach to healing spines. And as a result of that, when we do a Discseel procedure, it's very common that we're also going to do some regenerative medicine into the posterior compartment, into all the ancillary tissues, to help stabilize, prevent the condition from getting worse over time, and give the patient the best opportunity for outcome. So, I mean, really the bottom line is that qualification or qualifying patients is absolutely essential to putting people in a position where they get highest likelihood for success. In our office, we recognize that, with procedures like this is not a one-time event. It's essentially, if we have a chronic spine issue, which is the vast majority of people that we see, this has usually been there for quite some time. So there are many things that have to be addressed. Yes, we want to make sure that we qualify patients, and we know for almost certain that that patient is going to improve with the tools and resources that we have, because we never want to, provide patients with hope where it doesn't exist, especially given the fact that we have that clinical experience. But then once the procedure takes place, then we follow that patient for an entire year. Remember that because healing takes time and different tissues will heal along different patterns and along different time frames, we have to follow that patient. We have to monitor their progress. We have to give them information ongoing about how to create an environment that's conducive to healing, give them the best chance with the window that they have, so that they can achieve the outcome that they want. And with that comes, scaling in exercises or scaling in activities of daily living that would be consistent with conditioning their spine for the long term, right? Remember that if this condition has been there for years or for a long period of time, they're going to be relatively deconditioned. There's going to be a functional component to their issues, and going in and healing things really is just the first step. I mean, that's kind of the easy part. It's a one-day procedure. Yes, it's very comprehensive. Typically, there's no downtime or need for recovery, so patients can resume normal activities immediately following, which is wonderful. But then it's really about educating them on how to scale in exercise and stability, because once the symptoms resolve over time, then we want them to be fully functional, and we want that process to last as long as it possibly can, if not permanently. So if you're curious about whether or not you would qualify for a procedure like this, we're happy to chat. We're happy to do an evaluation, determine if there's a high likelihood for success for you, and whether or not it's even necessary for your specific condition.